This is a shoulder spica wrap that we're going to do. You would need to choose a 6-inch in length double ace wrap. And this is usually used to support someone who has an unstable shoulder or has injured their glenohumeral joint. So maybe they have a labral issue and they just have too much movement here. We want to provide a little bit of support for them during their sport activity or during their activities of daily living. What you want to do is start your anchor of the shoulder spica right about the midpoint of the arm, approximately where you would put someone's blood pressure cuff if you were taking their blood pressure. We want to hold the wrap this way, not this way, because you want to be able to create tension very easily. So I find that's the better way to do it. We're going to apply this right on the lateral aspect of the arm. As I move forward, she's going to maintain this patient position, which is her arm is bent on the side of her hip, so her hand is on the top of her hip, and her elbow is flexed. This will allow me to support the glenohumeral joint and to get around the trunk as well as the arm, which is what the figure 8 does. So the bottom part of the 8 is the arm here. And then I'm going to stand on the side here so that I can actually get around my patient pretty easily. And I'm going to go under the other arm and across the chest. But I'm not pulling too tight on the chest because, again, we're not trying to support the chest here, we're trying to support the shoulder. So where I will start to pull is here, down and under the arm. And as I do that, you can see I come up at an angle and it creates X's. And I'm aiming for this glenohumeral joint. So right now I'm right about to go on that glenohumeral joint after this one, and that's where I want to go the whole time. So you see how I come up and across the glenohumeral joint, but I don't go across her throat area. So now I'm actually where I want to be. Another X, you can see that I'm overlapping by about an inch each time, and just slowly going up to reach the glenohumeral joint. Where do you end the wrap? Wherever the wrap wants to end. So I can tell my wrap is about to run out. So I will ask my patient to hold this ace wrap right here. I will grab some white tape and close it up. So let me just grab the white tape. And then I'm going to close it up just like so. Very simple. Even if you have tape you used for something else, you can still rip that end piece off. And I'm going to go right across the end point, and I'm just fanning it a little more than half, all the way across. If you use the white tape, you need to be sure to cover the entire end piece, above and below, so that it doesn't come off. Smooth it out. This would be one option. The other option is to use the Elastirap, which would go all the way around, and you can finish up with a final shoulder spica. And that's our shoulder spica.